22 people a day are dying from overdoses, and drugs have flooded our streets, and addiction has taken thousands of families hostage. The Conservatives are the only party saying enough with this wacko drug policy. Safe supply. So how does this work? Safe supply is ultimately this idea that somebody who is dealing or battling with addiction would walk in and they would be given a supply of dilaudid. On the street, they're called dillies. Okay, this is a highly addictive opioid. They are given 30 of them, dilaudids or dillies. They go out and maybe they want to do the right thing and take them and try to level out, but it doesn't work and they need something stronger. So they sell that. It's called diversion. They sell that on the street. It brings down the value of the drug, and then they go out and they seek something stronger. And now you have all of this safe drugs. This is how the drug dealers sell it to the kids, high school kids. They go around and they say, hey, this is safe. It's only $1. Your parents can take it. They buy this. They now get addicted to opioids. You have a whole new generation addicted to opioids. Okay? And then what happens is you have people, the addict is progressing and they go and they take fentanyl, street drugs, and they die of that fentanyl overdose. And that's why you have people, especially in the NDP, that say they're not dying of safe supply, they're not dying of diversion. They're dying as a direct result of the failed experiment of safe supply.
London police unveiled the results of a significant drug bust today, worth more than $750,000. They also say thousands of the pills they seized ended up on the street through safe supply diversion.
For the first time, London police are speaking out about the diversion of drugs happening in this community.
Diverted safe supply is being resold into our community. It's being trafficked into other communities, and it is being used as currency in exchange for fentanyl, fueling the drug trade.
At a press conference today, Chief Trong was joined by the Executive Director of Intercommunity Health Center, which is one of several healthcare providers who prescribe controlled substances to the city's most vulnerable population.
We take the potential for diversion seriously at the health center and have protocols to minimize the risk.
Those protocols include patients providing urine samples to ensure the medication they're being prescribed is in their system. If there's any indication that diversion is happening, that person is removed from the program. But despite those efforts, police revealed data today that indicated the number of safe supply prescription tablets seized has significantly increased in the last 5 years.
So far in 2024, we've seized just over 12,000 hydromorphone tablets, the overwhelming majority of which, meaning all but 675, was in dilaudid 8-milligram form.
The upward trend in diversion is something Mayor Josh Morgan says is evidence that clearly shows the status quo is not working. Along with the drugs, police also seized dozens of weapons, over 80 grand in cash, and say 50 people are facing hundreds of charges related to drug trafficking.
This is the reality of what has happened after 9 years of this Prime Minister.